Let's talk about vaginismus. To start, let me explain what vaginismus actually is. Vaginismus is a form of pelvic floor dysfunction where the pelvic floor muscles involuntarily contract or spasm when penetration is attempted. And this doesn't have to be sexual penetration. Even using a tampon, inserting a finger, or using a menstrual cup can be difficult, if not impossible, for someone who is suffering from the symptoms of vaginismus. And whereas it is normal to have some difficulty and pain when you first try to use a tampon or you try sexual penetration, this usually resolves with practice. But in the case of vaginismus, there is no progression, even with consistent practice. It can feel like there is a wall preventing penetration, and this is due to the contracted pelvic floor. It's important to remember that these contractions are involuntary, so you have no control over them. These involuntary contractions can be viewed as a protective response from your nervous system. There are multiple different types of vaginismus, and the first is primary vaginismus. And this is where partial or full penetration was never possible. This type of vaginismus is typically discovered during puberty or in early adulthood. The second type is secondary vaginismus. This is where penetration was once possible but is no longer achievable without pain or great difficulty due to these involuntary contractions of the pelvic floor. This can happen following childbirth. If you're going through menopause, it is sometimes a symptom of menopause, or if there has been a pelvic surgery, if there has been radiotherapy for cancer, for example, or some sort of trauma within the pelvis. And this type of vaginismus is typically discovered in mid to late adulthood, but it can happen at any point. And lastly, there is spontaneous vaginismus, which could be considered to be a normal protective response because it happens when penetration is forced. Spontaneous vaginismus can also occur when something is inserted into the vagina, such as a tampon or vaginal weights. And in that case, sometimes the pelvic floor muscles can contract involuntarily, preventing the removal of the tampon or of the vaginal weights. But spontaneous vaginismus is not considered true vaginismus because it's not a chronic condition. Generally, it can be resolved in a short time without needing extended treatment. The cause of vaginismus isn't actually well understood. Although vaginismus impacts between 5 and 17% of women globally, studies into the condition are quite limited. The contractions are completely involuntary. Your autonomic nervous system controls your bodily functions, so you operate either in rest and digest, where you're relaxed and at ease in your body, or in fight or flight mode, where you are tense and anxious. Studies into vaginismus have shown that women who have vaginismus have heightened sensitivity that results in hyperactivity at rest. And that means that their pelvic floor muscles have a tendency to be more hypertonic, which suggests more fight or flight activity in the nervous system. One study looked at the areas of the brain that are responsible for anxiety and fear, comparing women that had vaginismus against women that didn't. And what they found were structural changes in the brains of women that had vaginismus. And this suggests that vaginismus may be a fear-related condition. It may be a fear of penetration or a fear of pain. Fears can be cultural or religious in nature. Fear of a gynecological exam can even trigger the vaginismus response. But the good thing is that fear can be overcome. If you believe that you have vaginismus, it is really important that you don't self-diagnose. The diagnosis is typically made by a gynaecologist. You should contact your gynaecologist beforehand to let them know if you think you have vaginismus, because this will ensure that they are aware of your fears ahead of time and they can prepare properly for your visit. When you have your exam, they should begin by giving you a mirror so that you can look at your vulva, and they can explain what the different parts are, and they can talk you through the exam before they begin. A speculum is often used for gynecological exams. They may be able to use a small speculum because of your vaginismus. Before they use the speculum, they will likely use a Q-tip to see if you can relax for that, and if you're okay with the Q-tip, they may guide you to insert either 1 or 2 of your own fingers to see how you manage with that. They're then going to proceed with the exam if it's possible, and they will grade your vaginismus if they find that you have it. And you can find information on the grading of vaginismus on our Vaginismus page, which I will put a link for in the description below. Once you've been diagnosed, then you can discuss the treatment options. Treatments are dependent on the grade of vaginismus, and regardless of what grade you have been given, the first step will be to remove tension from the body, and more specifically to try to remove tension from the pelvic floor. And if you've been subscribed to the channel for a while, then maybe you're already doing some of the exercises to help to reduce pelvic floor tension. You could also benefit from adding in Yoga Nidra, which is a body scanning meditation where you close your eyes and you relax and scan through the body, looking for and releasing tension as you find it. Overcoming fear is also really critical when trying to deal with vaginismus, and you can work with a psychologist or a sex therapist to help you overcome your fears. It can also be very beneficial to do these types of therapies along with your partner if you have one, because that will help to communicate a message of safety to your nervous system when you are attempting penetration with your partner. Depending on your grade of vaginismus, you may be prescribed dilator therapy. Dilator therapy uses medical grade dilators to help train the pelvic floor muscles to relax in order to allow penetration. These dilators range in size starting around the size of a baby finger and then increasing gradually in size. In some countries, dilators are not available, and it is okay to use fingers instead of dilators in that case. You should always wash dilators both before and after use using a gentle soap, and then make sure you dry them fully before putting them away. If you're finding it difficult to go deep with dilators or with penetration when you eventually try, you can use the O-nut devices to reduce the length and allow you to work with a shorter length until you feel comfortable. You'll find links to the O-nuts and dilators, as well as a link for my book in the video description, and it has a lot of symptom management strategies detailed to help with overcoming vaginismus. If you want to ask me some questions, then you can add a comment to the video or jump over to our community at theflowerempowered.com. You can ask your question there. You should watch this video next to find out a little bit more about dilation.